Hi, my name is Laura Jensen. I would like to thank you for choosing St. Croix Regional Medical Center for your upcoming surgery. We prepared this video and booklet to help you navigate through the entire process. We encourage you to involve a family member or friend in the process if at all possible. We understand that having a total joint replacement is a big decision, and we are committed to providing you with excellent care and unsurpassed customer service before, during, and after your surgery. We have carefully planned your care with the goal of a successful recovery to help you return to a more active lifestyle. Your role is critical in this process, and we encourage you to speak up if you have any questions or concerns. Thank you, and we look forward to serving you and your family.
Patients who require a total knee replacement or total hip replacement have painful arthritis limiting their quality of life. By replacing their hip or their knee, we're hoping to relieve their pain and restore their quality of life and improve their function. After having a hip or knee replacement, it's very important to have early ambulation and early return to function. The sooner we can get our patients moving safely with good pain control, the better our patients tend to do. The typical length of stay in the hospital after a joint replacement is about 2 to 3 days. Some patients can go home the day after surgery. Other patients require a few more days. The procedure for a total hip replacement is to remove the bone-on-bone ball and socket articulating surfaces. The ball is completely removed and replaced with a metal ball. This articulates with a resurfaced plastic socket, resulting in a metal-on-plastic hip articulation. As a patient, you can take an active role in your recovery after a hip or knee replacement. Having good pain control and a positive attitude, looking forward to recovery, helps tremendously.
Hi, my name is Janine. I'm one of the nurses at St. Croix Regional Medical Center. I work on the medical surgical floor. I will be one of the staff members that you might be seeing after you come up from the recovery from surgery. Once you come up, we will orient you to the room, show you how all the controls work, the call light, the bed controls. We will be taking vital signs very frequently throughout your stay, but especially in that first 24 hours. We'll be also asking you about pain control. That is our main concern when you first come up, is we want to make sure that pain gets under control before it gets out of control. So oral pain medications take at least a good 30 to 45 minutes to kick in, so we would prefer if you start to let us know when you feel discomfort. The pain management scale that we will be using is a 0 to 10, 0 being no pain, 10 being excruciating pain. So when you start to get to about a 2 or 3, we would like to know so we can get it under control. That very first night that you are here, we will be trying to get you out of bed and into the chair for your meals. If you're feeling good, we'll take a short walk throughout the room and possibly in the hall, depending upon how you are doing. And we will continue with physical therapy and walking throughout your stay.
My name's Bonnie, and I'm the social worker at St. Croix Regional Medical Center. And while you're here in the hospital, you can expect a visit from a social worker or a discharge planner, and we're going to meet with you and talk to you about what your needs might be after you're ready to leave the hospital after your surgery. You should be thinking about what those needs might be before you come here. You might want to check with your insurance company to see what kind of coverage you have so far as needing physical rehab as a inpatient somewhere, or if you're going to need some home care services, you can find out from your insurance company what you might have for a copay for any of those kinds of services before you even get your surgery done. So then once you're here, we're going to come into your room and we're going to talk to you about what you should be expecting when you leave here. Well, you can have one of 3 options. You can go home with a family member or friend or neighbor to take care of you when you go home, or you can get some home care services if you qualify for in-home care, or you could go to a transitional care facility for rehab there. It would be a good idea if you went to visit a few facilities in your area. Generally, people go to the rehab center that's in the community where they live. You might want to go and take a visit there and see what it's like, so that way you would know what to expect when you get there. If you choose to go home after you have your surgery, it's important that you make arrangements for someone to stay with you at least for a few days, because you're going to need help with personal cares and mobility and medication management and someone to drive you to your appointments. It's just going to be hard for you to be home by yourself. After you're discharged from the hospital, if you go home, you're going to need some follow-up care. You will probably or possibly need some physical therapy, and you will also need blood work done to monitor medications that you're on. So any of those things can be arranged at the local clinic that's closest to where you live, and those arrangements will be made for you while you're here in the hospital. Well, what I do want people to know is that you don't need to worry about making all these arrangements before you come into the hospital. So if you come in here and you're concerned about where your placement will be, if you're going to go home, if you're going to go to the nursing home, you can be assured that the social worker or discharge planner will be able to help make those arrangements for you while you're here in the hospital.
The most important person in the recovery process is you. Take an active role. The more you can understand about what to do and what not to do when you go home will improve your outcome and your experience. It's important to stay active. Get up every 30 minutes to promote circulation, avoid complications. Start by just taking a few steps around your house and gradually increase that. Performing your physical therapy will be important to regaining your range of motion, your strength, and your function. Practicing the exercises before surgery can be helpful. Remember, your exercises shouldn't cause sharp, severe, or increasing pain. If they do, stop and call your therapist. Ankle pumps, quad sets, and glute sets. These are exercises that can be done in bed or reclined. They're to improve your circulation and avoid complications. You should do them frequently through the day, every couple of hours. Ankle pumps. Ankle pumps can help prevent circulation problems such as blood clots. Do ankle pumps by pointing and flexing your feet. Quadriceps sets. Lie on your back in bed, legs straight. Tighten the muscles on the front of your thigh as you press the back of your knee down toward the bed. Hold for 3 counts, then relax. Gluteal sets. Squeeze your buttocks together gently. Your hips will rise slightly off the bed. Hold for 3 counts, then release. Heel slides, hip abduction, and straight leg raise. These exercises are to improve your range of motion and improve the strength around your new hip joint. Heel slides. Keep the heel of your operated leg on the bed. Slide it toward your buttock as far as you comfortably can. Hold for 5 seconds, then slide your heel back. Hip abduction. Start with your feet slightly apart. Keeping your knee and foot pointed toward the ceiling, slowly slide your operated leg out to the side. Slide your leg back to its starting position without crossing the midline of your body. Remember, keep your toes pointed toward the ceiling. Straight leg raises. Lie in bed, bend one leg. Keep your other leg straight on the bed. Tighten your thigh muscles and lift your straight leg about 12 inches. Hold for a count of 5. Slowly lower the leg. You may need assistance initially with this exercise. Standing hip abduction, standing hip extension, and long arc quads. These exercises are designed to improve the strength of your hip and thigh muscles. Standing hip abduction. Stand with your hands lightly resting on a counter or other firm support surface. Stand on your non-operative leg. Move the operative leg out to the side. Pause and return back to the starting position. This will be a small movement. Do 10 to 20 times. Standing hip extension. Stand with hands lightly resting on the counter or other support surface. Stand tall on your non-operative leg. Tighten your abdominal muscles, keeping your operative leg straight. Move the hip back. You should feel the large muscle of your buttock working. Return to the starting position. This will be a small movement. Your trunk should not move. Do 10 to 20 times. Long arc quad. Sit on a firm chair with a towel under your knee joint. Straighten your leg as far as you can. Hold for 5 counts. Then relax down to the starting position. Remember, walking will be your best friend. Start walking short distances and gradually increase. This is the best way to improve your overall health, strength, and function.
Hi, my name is Mindy. I'm an occupational therapist here at St. Croix Regional Medical Center. My job is to make sure that you get back to your normal daily life activities as soon as possible. In this segment, I will be discussing tub transfers, car transfers, and dressing techniques. You must protect your new hip by following certain precautions. You must avoid certain positions and movements. This will allow your hip to heal and keep it from dislocating. Do not bend at the waist or reach for objects to pick them off the floor. Do not sit with your hips below your knees. Do not cross your legs. Keep your thighs apart. Do not turn your surgical leg inward. There are different tools available to help you follow these precautions. Well, here's a recommended technique to help you put on your pants. Sit on the edge of your bed or on a firm chair. Take your reacher, grab the center of your pants near the string tie or zipper, lower your pants down to the floor, and slip the pants leg onto your operated leg first, and then over your non-operated leg. Use the reacher to pull the pants over your feet. Stand and pull up your pants over your hips. Here's the recommended way you can put your socks on after surgery. Sit on the edge of your bed or a firm chair. Take your sock aid, placing it against your stomach or between your knees. Stretch your sock over the sock aid with the heel of the sock on the bottom of the sock aid. Put the sock on the sock aid as if you were putting it on your foot, keeping it just below the rope knots. Drop the sock aid to the floor and slip your foot into the sock aid. Pull the sock aid up toward you until the sock is on your foot. There are a few different ways to shower or get into a tub after surgery. We recommend using a shower chair after surgery. If you have a walk-in shower, you may use that if you have a sturdy grab bar and you feel comfortable standing. If you own a tub, back up until you feel the tub bench behind you. Reach back for the bench first with one hand, then the other as you begin to sit down. Place your operated leg forward as you sit down. Lower yourself onto the bench and turn to face the faucet. Use your hands to help lift each leg over the side of the tub. A handheld shower nozzle can make bathing on a bench easier. Do not take a bath or sit in a hot tub until your surgeon says you can. There are certain ways to get in the car that will make it easier and more successful for you after surgery. Have someone move the seat back as far as it will go, recline the back of the seat, and place a plastic bag on the seat to help you slide back on the seat. Stand with your back to the car. Keep your operated leg straight and the foot slightly forward. Feel the car touch the back of your non-operated leg. Lower yourself slowly onto the seat. Slide back onto the center of the seat. Lift your legs one at a time into the car. As you do so, move your body, do not twist. When you're lifting your leg into the car, be sure not to lift your knee above your hip. If you have further questions regarding dressing, bathing, or transfers, please consult your handbook. Thank you.
My name is Cheryl, and I've had a knee injury 3 years ago riding my motorcycle. It was very painful to the point where when I walked at work, which is, I have to walk quite often, I was ready for a wheelchair. The pain was so excruciating. I couldn't take it anymore. I was not able to do any of the activities that I normally would be able to do. I wasn't able to walk well. I couldn't ride my motorcycle for a whole season. And it just became so painful when it became bone on bone. And at that point we decided, when injections and medications weren't working, that I would pursue seeking out joint replacement surgery. Lo and behold, the surgery only took an hour because of that surgeon's expertise. It was totally amazing. It was just, I didn't expect that. It was quick. I also performed my exercises that were shown to me by the physical therapy people and performed those in the hospital, as well as when I got home, I continued on with the physical therapy and the exercises, because without that, you're not gonna get to where you need to be for that recovery. The biggest thing really is your attitude. Attitude is everything. If you feel that this is going to be a good thing and you have the positive attitude and the smile on your face, even through the pain, when you leave there, it feels so wonderful. 4 months after the surgery, I am now riding my motorcycle, and I am now able to walk and walk fast with little to no pain. Without the treatment that I had at the hospital and the physical therapy, I wouldn't be here today.
Even though we care for many patients, we know that each person has unique needs, and we will work together to personalize your care and to make you as comfortable as possible. Our entire team, including the surgeon, the physicians, the nurses, doctors, therapists, and pharmacists, are focused on providing the very best care for you. Thank you for allowing us to serve you and for choosing St. Croix Regional Medical Center, your first choice for care.